Hi, my name is Dr. Laura Stein. I'm a stroke neurologist here at Mount Sinai, and we're going to talk about things you need to know about stroke as part of Stroke Awareness Month. A stroke is an injury to the brain that's caused by problems with the normal blood flow. There are actually two types of stroke, ischemic and hemorrhagic. Ischemic strokes are most common. They happen about 80 to 85% of the time, and they're caused by a blockage of a blood vessel. That means not enough oxygen is getting to the brain. With a hemorrhagic stroke, which occurs about 15 to 20% of the time, there's a rupture of the blood vessel, and this causes bleeding in the brain tissue or the fluid surrounding the brain. We have an acronym BFAST to help remember both the signs of stroke as well as the importance of acting quickly when we think that someone may be having a stroke. A stroke is usually sudden in onset, and it may involve one or multiple signs in the BFAST acronym. B stands for balance, such as difficulty walking or problems with coordination. E stands for eyes, such as double vision or loss of vision. F stands for face, such as drooping or numbness. A stands for arm, again, such as weakness or numbness. The same applies to the leg. S stands for speech, such as problems talking or communicating, problems understanding what someone's saying or reading, or sounding confused. And finally, T stands for time, again, to reinforce the importance of calling 911 because time is brain when someone may be having a stroke. During a stroke, the area of the brain around the blocked or bleeding blood vessel dies as a result of the lack of oxygen or pressure on the brain. The brain needs a constant supply of oxygen for us to live and function. And when a part of the brain loses its normal supply, brain cells can begin to die. Believe it or not, the brain cells are at risk for dying within seconds of the stroke beginning. And this is really why we again say time is brain. Sometimes we have only as short as 4.5 hours from the time the patient was last their normal self to give medication to try to break up the blood clot and reverse the stroke. The sooner we treat stroke patients, the better they do. Our goal is to diagnose a stroke within minutes of arriving at a hospital. And this is so that we can give patients potentially life-saving treatments that may actually restore their normal neurologic functioning. We start by quickly speaking to the patient and their family member. It's important to find out when they were last able to do the things they normally do, what their symptoms are and when they began, their medical conditions that put them at risk for stroke, and any medications or conditions that affect their eligibility for one of our life-saving treatments. We perform a very short neurologic exam that helps us understand where the problem in the brain likely is, and also determine how severe the stroke symptoms are. Finally, we perform CT scans of the brain and the blood vessels of the brain. This is like a 3D X-ray that's performed within minutes. After all of this, which again, we try to do within minutes of arriving at the hospital, we discuss whether the patient is eligible for a clot-busting medication called tenecteplase or alteplase, a surgery to pull out the clot called thrombectomy, or treatment to stop the bleeding and relieve pressure if it's a hemorrhagic stroke. There are almost 800,000 strokes in the United States every year, and most unfortunately, about 1 in every 4 of the strokes that happen are actually a recurrent stroke. It's important to remember that anyone of any age, and really at any time, can have a stroke. No one should hesitate to call 911 if they think that someone could be having a stroke, even if the person in front of them doesn't seem like the typical person to have a stroke. Having said that, stroke happens most often in individuals who are over the age of 60 and have high blood pressure, especially when that high blood pressure is not well controlled. Most people don't realize just how common stroke is. An adult's risk of stroke over their lifetime is actually around 25%. And if we look at adults of all ages over 20 in the United States, around 3% or nearly 7 million people have actually had a stroke. The best way to treat a stroke is really by preventing it. And the things that you can do to reduce your risk of stroke include treat your high blood pressure, lose weight, exercise, limit alcohol, quit smoking if you happen to smoke, and see your doctor about the best medications for other conditions that we know increase your risk of stroke, such as diabetes, high cholesterol, atrial fibrillation. Call 911 immediately. The paramedics know as well as anyone that time is brain, and they will take any individual who may be having a stroke to the closest hospital that's capable of giving them the life-saving treatments we have.